Welcome back to another episode of hMPV, a common yet unknown respiratory threat. In this podcast series, we are talking to experts to understand how hMPV impacts older and at-risk adults, as well as how we can best protect ourselves from this little-known yet common respiratory disease. In the last episode, Ms. Tanya Winders and Mr. Radu Constant-Ganescu provided insights of challenges faced by various patient communities during the respiratory disease season. Additionally, Dr. Melissa Andrew discussed her experiences in treating older adults among other at-risk groups with respiratory diseases, including hMPV. This episode provided a balance of patient, caregiver, and healthcare provider perspectives to share a person-centered lens on hMPV, recognizing the great impact that stories have in promoting awareness. And in the final episode of this series, Dr. Brian Labus delves into the broader public health perspective, exploring the societal consequences of hMPV, as well as current research and development in this area. Thank you so much, Dr. Labus, for joining us today. I'm wondering if you can just give us a brief introduction and tell us a little bit about yourself.
So I'm Brian Labus. I'm an infectious disease epidemiologist, and I'm an assistant professor at the UNLV School of Public Health. I've spent the last 25 years working in infectious diseases. And in doing that, you spend a lot of time dealing with different respiratory diseases because they're the biggest issue that we deal with in our community every single year. So my background is studying all sorts of diseases like this. I did a lot of work on COVID. My whole career, I've done disease surveillance, so tracking flu every single year. When we had the 2009 flu pandemic, the last one we had to deal with, worked on that. And I've worked on a lot of different infectious disease topics over my career.
Thank you so much. So I'm wondering if you can share a little bit about hMPV and if you can tell us a little bit about kind of the morbidity and the mortality associated with hMPV, and how is this similar or different to other respiratory diseases that you've mentioned?
So hMPV is a fascinating disease in that it's very, very common. It looks like other diseases we deal with every single year, and nobody's heard of it. It's one of these things that it's amazing that people don't know it exists. It causes a respiratory disease similar to ones that we see every year. So when we talk about respiratory disease season popping up, usually in the winter months, so we start to see it increase in the fall, but January, February, March, we see the most activity. It causes the kind of diseases that people get every single year. It causes a respiratory disease with a cough, fever, running your stuffy nose, sore throat, wheezing, and it can have some serious respiratory consequences. It's probably most similar to RSV. So everybody's heard of that. We think of it as a disease of very young children and one that can be very serious when you're older. Same sort of thing with hMPV. It is a disease that for the average person, it presents like a head cold. It's not going to be something that puts you in the hospital, not something that kills you. But if you have serious underlying health problems, and as you get older, it can cause a lot more serious disease, shortness of breath, and those things are nothing to take lightly. And so that's what leads to hospitalization. And as we get older, we have all sorts of other underlying respiratory problems. So things like COPD become more common, things like diabetes and heart disease and other issues. And those just make it worse when you get a disease like this that for a person who is otherwise healthy may not have a serious disease. If you have a lot of underlying conditions, it may put you in the hospital. From the data that we've seen, it looks like this disease is about as common every single year as influenza. So it's amazing that people haven't heard of it, but it's something that is out there all the time and as something that we all deal with. By the age of 5, everybody has antibodies in their blood basically showing that they've been exposed to it. So it is an incredibly common disease, but you'll never hear about it because it's not part of our disease surveillance systems. We just don't know much about it. We don't track it. It's just flies under the radar, unfortunately.
Yeah, I think that's really interesting to hear that it's just as common as flu, because obviously there's so much conversation about flu, and that has such a higher degree of awareness. So how would you describe some of the more kind of public health burden of hMPV? So when we think about, maybe more of the economic burden or the burden on our health systems and things like that.
Well, hMPV is a very common infection. So even if it doesn't cause death very often in cases, if a lot of people get it, it is going to cause deaths. It is going to cause hospitalization. So even though these things might be a rare outcome, just we have so many cases that it is going to put a burden on our system. And if we think of it like the common cold, something that's a mild respiratory illness, it isn't overwhelming anything really, but it does have a significant effect on our workforce. If you have colds and respiratory diseases going through offices, if we have it in nursing homes and things like that, it is something that takes a lot of work. It takes away the quality of life, and it can be for an extended period of time. For most people, it's a few days and you get better, but you still have lost a week of your life to feeling miserable. So even though it's not killing people, it does have a huge economic burden, just like any other respiratory infection. We think of them as mild, but there's nothing mild about it when you have it and you feel absolutely miserable. So just the degree to which our society deals with this, there is that massive economic burden. There is some burden on our healthcare system. We see it in little kids and at the same time as RSV. And so when all of these respiratory things hit at the same time, that can overwhelm our healthcare system. Anyone on their own isn't going to do it. But if you take flu and RSV and human metapneumovirus and COVID and have them all happen at once, it just winds up clogging up emergency rooms and urgent cares everywhere. And we do have people wind up being hospitalized with it as well. It's just one of those respiratory things that we deal with every single year that has a really general burden on how we feel.
And, what strategies are you aware of, if there are any, surrounding kind of health promotion or any programs that might address hMPV amongst older adults?
Well, I think this is the biggest problem. There really aren't programs because nobody knows about it. Even within medicine and public health, these are not well-known disease. This is not a well-known disease. People may have heard of it, but they don't know much about it. But we also don't know much about it scientifically. And I think that's the other challenge that we deal with. We know that it's out there. We think we understand how it spreads. We have a rough idea of what the incubation period is, but it's not well characterized like flu or COVID or some of the things that we just jumped into and spent an incredible amount of time trying to understand. And so along with that, clinicians don't think about it. The public doesn't think about it. It's not included in public health surveillance systems. So the big issue is just this lack of awareness. And there really aren't programs to change that. We're still trying to understand things, and that's going to become a lot more important if we ever develop a vaccine for this, because how do you get people to get vaccinated against something that they don't see as a problem?
Yeah, absolutely. I think that's a nice segue into, what is the status of vaccine development for hMPV? And, if we are to have a vaccine, how can we build up some of these programs and systems so that people are aware of hMPV and they are surveilling it and studying it?
There are vaccines undergoing clinical trial for hMPV. The ones that I've been able to find were still very early on. It's not the widespread phase 3 clinical trials yet. It would be nice to see things move to that, but it just takes time. With a vaccine, it's not like you can treat it and have the results within a few days and the person got better. They didn't. You really have to look over the course of a whole season. So it takes a long time to do these studies. And the first studies have to look at the safety of the vaccine and is there any potential that it's actually going to work and what's the downside of it. So we're still early on in that whole process of developing the vaccines. If we had a vaccine come to market today, we have to convince people that it's in their best interest to get it. If they don't know what the disease is and they don't see it as a serious threat, when they make that mental calculation about is it worth it to me to get this vaccine, they're not going to see any benefits to the vaccine. So it makes it very difficult to convince them that it's a good idea to get vaccinated. And vaccines work at the individual level and they work at the population level to protect all of us. So we have to really think about how we're going to convince the community this is something we need to do to protect everyone. And it's part of a larger vaccination program. It's not just like a medication you take for your cholesterol or something like that. It really has societal benefits. And we struggled a lot with that with COVID. In the best situations, we've got about half of the community vaccinated against COVID. And that was for a disease that was on the news every day, killing people. So for a disease that people don't see as serious, it's going to be a very difficult conversation to convince them that the vaccine makes sense. So we have to start now in helping people understand this is a disease that's out there and make them actually want the vaccine when it comes in.
And in your opinion, how can we start to improve that awareness of hMPV?
Well, I think people don't understand what it is. We don't talk about it when we talk about respiratory disease season. We talk about flu, we talk about COVID, we talk about RSV. No one has ever mentioned hMPV in an interview. It's the fact that we're doing this podcast right now is great because people will hear about it probably for the first time. And part of that has to do with it is a new disease. This is something that we discovered in 2001. It wasn't like it just emerged in 2001. It'd probably been around for about 50 years and we finally identified the virus, but it's a new thing that people haven't heard of. That's really the challenge we're at right now, just getting people to understand that it exists and then the degree to which it's burdening our community. And it's hard to talk about that when we don't have good numbers on that either. It's not part of our surveillance system. So it's really a combination of everything we need to do through the medical and public health systems to get people to understand what this is and how serious it is. But for some of the things, we can't talk about it until we truly characterize how serious it is.
And then, to that point, how can kind of diagnosis, testing, surveillance be improved? Would you say that, that might be a helpful first step, in understanding burden, but also raising awareness? So are there any strategies that we should be kind of implementing to improve testing and diagnosis and surveillance?
On the surveillance side, we have it included in some surveillance systems. We did a program in Southern Nevada some years ago. We were looking at just what was circulating in the community and characterizing about 20 different viruses every year and putting out information to clinicians and saying, here's what's going on. And it helped get awareness that the disease was out there. We need to do more of those things nationwide. The challenge with surveillance is that this is not a disease that drives people to medical care most of the time. And if they are getting care, there really isn't a treatment for it, so testing for it doesn't make sense. If you come into the doctor's office with a mild respiratory illness, they're going to give you something to feel better and probably never test for what it is. And within a few days, you're going to feel better anyway. And so conducting the test really doesn't have a benefit to the patient. And so it doesn't make sense to do that testing unless somebody winds up hospitalized with serious disease. So as a result, it's not something we really track. We don't get those reports from clinicians unless we put that extra effort into building surveillance systems that look for diseases that are less well known and are not regularly tracked by clinicians, by putting a lot more effort into getting those specimens and doing those tests. So I think a lot of the burden falls on the public health system to really start tracking this and putting the information out there that this is what we're seeing right now. This is how severe it is, how serious it is, how common it is, and really let people know that this is in our community all the time, rather than some really one-off research projects to try and say, here's what happened over a short period of time in our community.
And, thinking about kind of the public health system, what do you think is needed to ensure that kind of public health system and decision makers on that side can take action? Is it maybe some evidence synthesis or research? How can we kind of put some of these structures into place, speaking to those kind of public health decision makers?
The issue with public health is the one we see for every public health problem. It's one of funding. Public health systems are not well funded. If an emergency happens, everybody wants to jump in and do something about it. We saw it with COVID. COVID showed up and there were billions of dollars thrown into all sorts of different surveillance programs and research projects. But then when the emergency goes away, that funding dries up. So it's very difficult to get interest on these common routine problems that we deal with all the time. Influenza is something that we know is there. We have a surveillance system for it. We track it nationwide, but it's really underfunded, and we pay attention to it when a new strain pops up and it turns into something like the H1N1 pandemic we had in 2009. And that's really the big challenge with this, is getting it funded to the point where we say we are concerned about these problems all the time and we can track these things in our community and not just work on things when they're an emergency. And getting the mindset to change around funding, that we need to keep funding these projects and not just emergencies, is where it all starts. Because without that, we can't characterize what it is. We can't describe it. We don't know what normal is, so we can't talk about what abnormal is. And we can't say, oh, it's become a much bigger problem if we can't even say that it's a problem to begin with.
And what do you think is the role? I mean, I think there's a couple of stakeholders that can be involved in hopefully sharing that message. Some advocates like the IFA, for example. We're trying to do our part, but there's also healthcare providers that I think can be an important voice, as well as public health experts like yourself. Do you have any kind of specific kind of calls to action for these groups, in how to kind of get involved in sharing that message and sharing how to emphasize the public health importance, but also build up some of these systems?
it's really quite a challenge to sell public health to anybody. And so we can get people talking about it, but you really have to uh, put the money behind it to really make a difference. And that's always been the challenge. And so when my students ask about that sort of thing, I always tell them the same thing. Think about public health when you're voting. Think about which candidates are going to support public health initiatives and put the things in place that we need to improve our community. Everybody is willing to jump in when there's an emergency. It's the people that are willing to still pay attention to it when there's not an emergency and see these as regular problems. Our entire population is getting older. These kind of issues are going to become more and more important on a regular basis, but there's also that huge burden they just put kind of year to year anyway of just there's a lot of sick people and we feel miserable, and it'd be better if we didn't have to go through all that. And so for me, it's really just that general political action of thinking about prioritizing politics to support public health and rather than having it just be an afterthought.
So can you share kind of any key calls to action surrounding hMPV and how, we can prevent it, to kind of summarize in the final moments of our conversation?
Well, the biggest issue is awareness, like we've been talking about today. People don't know what this disease is. So the big call to action is to learn what this disease is. It's not really difficult to understand. It is a respiratory infection that's out there. It's not a one-off sort of thing. So understand what it is. And if you start to become aware of it, you start to see it, then you'll think more about it and it'll help change your behaviors and it'll start to change things both in our medical system and our public health system. And individuals will start to potentially think about this when the vaccine comes up then. So for me, the biggest call to action is learn what this disease is, learn that it exists, and learn how common this is as a problem worldwide.
Thank you so much. Thank you so much for your time today.
You're welcome.
As we wrap up our conversation and this series, we want to emphasize the critical points that Dr. Labus, alongside our other expert guests, have shared. Firstly, hMPV is shown to be just as common as influenza, with very similar symptoms to other common respiratory diseases. Similarly to other respiratory diseases, hMPV has a significant impact on healthcare systems and economies, including lower productivity and extensive hospitalizations. As Dr. Labus explained, during the peak respiratory disease season, hMPV contributes to the alarming burden on older and at-risk adults. Moving forward, the IFA supports key calls to action to improve awareness, care, and prevention of hMPV. At a system level, improving testing and surveillance of common respiratory diseases, including hMPV, is vital for understanding burden of disease and developing prevention strategies. On a societal level, we hope to continue the conversation and ensure more individuals have access to timely, relevant information on hMPV as a common respiratory disease. As we see time and time again, awareness and knowledge can be a powerful tool in combating infectious diseases, among other health concerns. And lastly, on an individual level, as research and development advances to provide a vaccine for hMPV, this will be a highly impactful tool to protect ourselves and communities from severe respiratory disease. The IFA would encourage you all to talk to your healthcare provider on the benefits of this vaccination as it becomes available. Thank you for listening. IFA would like to thank Sanofi for supporting this series. To find more information on this episode and view associated resources, visit vaccinesforlife.com. To join the conversation and continue the dialogue on hMPV, follow, like, and engage with us on social media.